The following segment is sponsored by the Family Heart Foundation. Heart disease remains the leading cause of death in America, but few realize the critical role that genetics can play when it comes to our heart health. Joining us now to discuss a genetic risk factor called high lipoprotein A, or Lp(a), is cardiologist Dr. Keith Ferdinand, along with Susan Riley, a Family Heart Foundation ambassador who has firsthand experience with this condition. Welcome to the show, both of you.
Thank you.
Thank you.
Of course. Susan, let's start with you. How has high Lp(a) impacted your family?
High lipoprotein A has impacted my family tremendously. Starting as a spouse, my husband was in his early 40s when he first started having heart conditions. We didn't understand why. We didn't understand what was happening. They were aggressive, and we just wanted them to stop. And then as a mom, I lost my daughter, Catherine, at age 23 of a heart attack due to high Lp(a). And that was hard because I didn't understand it and I couldn't help her. And then for myself, when Catherine passed, I was tested and I also have high Lp(a). So there's a host of emotions that go along with that diagnosis and learning how to navigate through my own health. So I would say my family deals with high Lp(a) every day in just about every way.
Yeah, sure. Susan, I'm so sorry for your loss. So sorry. Dr. Ferdinand, why is high Lp(a) so dangerous and who should be screened?
Well, first of all, everyone should be checked. High Lp(a) is actually quite common, about 1 out of 5 or 20% of persons. It's more common in people of African ancestry, so Black Americans. It's also more common in people of South Asian ancestry. But anybody can have elevated high Lp(a). High Lp(a) damages the blood vessels, therefore it can cause a heart attack, stroke. It can damage the aortic valve and damage the leg vessels, peripheral arterial disease. The other reason you get checked is because if you have high Lp(a), it's a genetic factor, meaning that your family should be checked, especially your first-degree relatives. That's mother, father, sister, brother, or even your children. So high Lp(a) is an independent risk factor outside of the conventional risk factor, but it is also a genetic condition and warns you that your other family members should be checked.
Okay, good to know. And Susan, how are you staying proactive about your health, and what advice would you give to others with high Lp(a)?
Yep. First, I'll say everyone should be tested. And if it does come back that you do have high Lp(a), find a community that understands the disease and can help you through that. I found that with Family Heart Foundation, where I learned tons about Lp(a) and what it does. I learned how to advocate for myself and others. I learned how to ask the right questions and find the right doctors. I learned that there are things I can do today to help reduce all other risk factors. And I learned that there's hope. There's hope. I don't have to live in fear of this disease. I can live with the disease.
Yes, thank you for sharing your story, Susan. Where can we go for more information?
The Family Heart Foundation is a nonprofit. You go to their website, they have a wealth of information, not only about high Lp(a), but other heart conditions. And you can get a free test from the Family Heart Foundation through cholesterolconnect.org.
Okay, great. Thank you for this information. And thank you, Keith and Susan, for joining us today. Have a wonderful day. It's great to see you.
Thank you.